So again, thank you everyone for attending to this webinar. And thank you, Suzanne, for being in the background supporting us. And let's get started with today's webinar. Today's topic is to take the helm of your COPD. This is a forum about patient empowerment and shared decision-making. Today, we will hear the voice of 6 key patient leaders from 6 world regions, and we will join a discussion to how we can help the patients take the front seat in their care plan. So this is the agenda for today. First, Tonya Winders will present the Take the Helm of Your COPD project. Then we will talk about shared decision-making and COPD empowerment. Then we will have 6 organizations from 6 different countries around the world presenting in us the 6 topics of the COPD empowerment guides that we created together with APEPOC and some NCBELES, which is the Research Institute of Pulmonary Diseases of Spain. And then we will finish with a forum. This is just a reminder, this event is being recorded and it's being transmitted live on Facebook. So if you're not comfortable with that, we encourage you to leave the meeting now.
Hello, everyone. I'm Tonya Winders, the president of the Global Allergy and Airways Patient Platform, as well as the president and CEO of Allergy and Asthma Network in the U.S. Hello, everyone. I'm Tonya Winders, the president of the Global Allergy and Airways Patient Platform, as well as the president and CEO of Allergy and Asthma Network in the U.S. It's my pleasure to come to you today and to share with you about Take the Helm of Your COPD. This is an important project that we know will make a significant difference in helping patients to be more empowered and to understand the importance of shared decision-making in COPD. This webinar actually is purposed to promote the empowerment of COPD patients worldwide and to encourage patients to be more involved in their daily disease management and key decisions around their condition, treatment, and monitoring. And really, we want to take into consideration their caregivers, their family members, and their healthcare providers, but most importantly, the patient, the person that is at the center of the care continuum and their own lifestyle and values. And so for that purpose, we have combined 2 different projects and initiatives to initiate this true global overview and to ask you, our member organizations, to offer your unique national perspective when considering how to utilize the patient empowerment guides and the shared decision-making video. So we're going to talk about each of these in a bit more depth. And again, I think the patient empowerment guides are tools that have take each and every component of living life with COPD comprehensively. And again, it's available in 6 languages and helps patients to understand what to expect and how to navigate long-term disease management with COPD. The shared decision-making video is a very short animated clip that really just gives the basics of shared decision-making and helps to explain why it's so important for all patients, those living with COPD, asthma, and other chronic conditions.
Thank you, Tonya. Next, we will show the shared decision-making video that GAAPP did in collaboration with partners.
When you visit your doctor, how involved are you in finding the best treatment? How do you know what's being prescribed? How does it work For how long? Is there an alternative treatment that might suit you better? When you share the decision-making with your doctor about your treatments, you will have a more confident understanding, allowing you to feel safe in the knowledge that you are receiving the best treatment for you. Shared decision-making allows you, the patient, to open a conversation with your doctor to help make mutual decisions about what treatments will work for you. It can help you as a patient understand how certain treatments work or what alternatives there may be. By talking with your doctor, you can work together to evaluate your own needs, as well as personal beliefs and values, to ensure you are getting treatment that matches. If you can't take certain treatments, you and your doctor can find an alternative. If your work or daily routine restricts your treatment schedule, you can find an alternative to better fit into your lifestyle and preferences. Shared decision-making works for you, helping you to communicate with your doctor to find the best option. There are 5 simple questions that you can ask your doctor to help make sure you are involved. How does the treatment work? What are its benefits? Are there any risks or side effects? What if I do not take it? Are there any alternatives? Shared decision-making, helping you to stick to your treatment plan, improving your quality of life and saving money and time.
So, why is shared decision making even important in COPD, and what is it? Shared decision making is defined as a process that includes healthcare providers and patients to make joint decisions about patient care. And this does engage the patient in a very active role. It changes that historical perspective of an authoritative or paternalistic approach to healthcare to a more shared and balanced healthcare experience, empowering patients as their own healthcare agents. And it's so incredibly important, especially in chronic complex diseases like COPD. And so oftentimes doctors will say, well, I don't have time to do shared decision making, or, how do I do shared decision making? And so actually it can come down to a very simple structure and framework of asking and answering 3 questions. What are my treatment options? What are the pros and cons of each option? And how do I get support in making the decision that's actually right for me? And so if we think about that framework of those 3 questions, that invites patients into shared decision making on the key aspects of their care. I often say you don't have the time not to do shared decision making because, again, we know that it leads to better health outcomes that we'll talk about more in a moment. But really taking into consideration what matters most to that individual patient. That's the fundamental baseline question that must be answered in shared decision making. Now, again, for any doubters around shared decision making and the importance of this in COPD, there's a recent article by Santiago et al., which actually looks at shared decision making and patient engagement in acute exacerbations in COPD. And so they took a group that was leading to post-discharge and provided shared decision making, and then a group that did not. And what they found is that universally, the shared decision making cohort actually had better health outcomes. And so they had a higher quality of life, better adherence, and control of their symptoms and the impact on those symptoms in the activities of daily living long term. And so we know that, again, there are tangible benefits to taking the time to do shared decision making effectively and appropriately in COPD.
Thank you, Tonya. Tonya Winders cannot be with us today, but she has recorded this part of her session on shared decision making. And now we will go to the second point of our agenda, the third point actually, which is the presentation of the empowerment guides for COPD patients that I'm sure most of you are already very familiar, as we have presented this project in several occasions and events. So our first speaker for today is Nicole Haas. Nicole Haas is a spokesperson and the technical advisor for APEPOC, which is the Spanish Association of COPD Patients. And she will be introducing us the first topic of the guides, which is prevention. And she will also take this chance to do the introduction to this project, as APEPOC, as we said before, was the official partner with GAAPP to create these empowerment guides.
Hello, everybody. I'm Nicole Haas, the spokesperson of APEPOC. APEPOC is the Spanish COPD Association, and very happy to be here with you, and of course to be part of the GAAPP community. It's so important to work as a team together and to learn from other patient organizations at the same time. As you know, GAAPP, in collaboration with our association, with APEPOC, and with the scientific review of CIBERES. CIBERES is the scientific network here in Spain, have created 6 guides supported to scientific evidence, international standards for the COPD management, as a tool that allows COPD patients, their families, and of course, at the same time, the society as a whole, in order to have better health decisions. The aim is the involvement of self-control, of its own disease, preventing its progression and achieving better life quality and longer life expectancy. Unfortunately, you know that COPD is very much underdiagnosed in every country, not only here in Spain, in every country, and neither patients nor primary care physicians sometimes know about it. So it's important to empower patients and societies and also health professionals. So prevention, the first step, is absolutely crucial. Let's check the main issues and also what our patient organization has done. The 6 main issues are quiet smoking and avoid exposure to smoke, air pollution, healthy diet, COPD nutrition, very important, staying active, of course, and performing supervised exercise routines, adherence to our or to your treatment, and get vaccinated. So what we did, what we have done here in our association here in Spain, we started, and this is for us very important, we start with some important action initiative related with quit smoking and avoid exposure to smoke, because you know that smoking is the main risk factor of our patients. More than 85% of our patients are smokers or ex-smokers. So what we did is we were accepted as a voting member of the National Committee on the Tobacco Prevention here in Spain. That is very important for us, because normally only scientific societies are accepted being a part of this national committee, and this allows us to be have the best information about their strategy, about new information about smoking, about tobacco, about what they are doing at this moment, and to be part of it. So very important for us. The next thing is the air pollution. I think it's the second most important risk factor for our patients, not only smoking, but also air pollution. We try to be there on an international and European platform at the same time. So we joined the initiative Ambition COP26. This is the platform for the summit for climate change. virtual platform, very important, and it allowed us to have the best information about new information about air pollution, to be part of it and to transmit all this information to our patients, to the families of our patients, but at the same time also to the society throughout social medias. At the same time, APEPOC has joined Breathe Vision 2030. This is a collective initiative driven by European level patient groups, very important as well. It was supported by the ERS and by the ELF Lung Foundation, collaborating for better respiratory health care and making politicians to move better on lung decision. So these are very important things for us. The third thing we did in the last time is the healthy diet, the COPD nutrition. I talked about this before. So important, the nutrition for our patient, you know. We need really a specific healthy diet for our patient related with COPD, with the COPD conditions. So what we did, we had an agreement with the European University Miguel de Cervantes in Valladolid, and we completed a joint research and awareness raising project, very important project during 6 months, including a pioneering study of nutritional status and eating habits. And if you want to take a look on it, you will find it on our webpage, and I include here the link. Very interesting results. So what we have to do next steps, because a lot of things to do still, you know, our COPD is it's a systematic pathology, very holistic. It needs a holistic approach. So we are working on a specific adherence program, because we noticed throughout a specific survey conducted by our patients, together with the Scientific Society of Pneumology in Spain, that pharmacy really is an important support for our patients. So we are trying to carry out at this moment a specific program in order to foster the adherence of our patients together with the pharmacy. And at the same time, we are working on vaccination, of course, as well. Vaccination is very important, not only coronavirus vaccination, also influenza, also pneumococcus, and at the same time, also tosferine vaccination. So it's more or less what we are doing at this time, but we have to do a lot more. So let's start and let's continue, and let's continue all together to have a bit of benchmark at the same time, to learn from each patient organization to other, and to have the best results in order to have a better results for our whole respiratory community. Thank you very much for attending my little introduction.
Thank you very much, Nicole, for your presentation. Nicole is here with us today, so later in the forum, you can ask her any question regarding her presentation or her incredible work with APEPOC in Spain at European level. Our next guest is Claudia Jimenez from FIQUIRES, Colombia. FIQUIRES is an umbrella organization for several respiratory conditions, and Claudia Jimenez is a respiratory therapist for FIQUIRES. This presentation was recorded in Spanish, but is subtitled in English.
Hola, un saludo muy especial a todos los miembros de la comunidad GAAPP. Hoy vamos a hablar sobre diagnóstico y cuidado en enfermedad pulmonar obstructiva crónica desde Colombia. Según la OMS, es la tercera causa de muerte a nivel mundial. Es una enfermedad que puede ser prevenible y tratable e igualmente afecta a hombres y mujeres en todo el mundo. En el año 2019 reportaban que a nivel mundial habíamos tenido 3.23 millones de defunciones, donde vemos que es supremamente alta la tasa de muerte. Algunas de las causas de esta enfermedad es la exposición prolongada de gases, partículas nocivas y factores personales. Pero algo que siempre me llamó la atención y que no se hace mucho énfasis en las causas de EPOC es la parte genética y los eventos que afectan el desarrollo pulmonar en la infancia. Aquí tenemos que ver que ha pasado con este adulto que presenta enfermedad pulmonar obstructiva crónica y tenemos que estudiarlo un poquito más para mirar en esa infancia qué sucedió, qué factores están contribuyendo para que este personaje tenga una enfermedad pulmonar obstructiva crónica. Es muy importante cuando estamos diagnosticando esto que se haga en forma precoz. Si nosotros hacemos tempranamente un diagnóstico, lo podemos controlar y podemos evitar que haya una progresión de esta enfermedad. Aquí van a ver ustedes, y les voy a señalar para que estén viendo. Aquí vemos un pulmón normal y un pulmón con una enfermedad pulmonar obstructiva crónica. Vemos cómo el cambio, cómo afecta en la forma, no más en la forma visual y obviamente en la forma funcional, es mucho más grave lo que se puede ver. Si usted es un personaje que es fumador o ha sido fumador, aunque ya no esté fumando, es fumador o ha sido fumador, es mayor de 40 años y presenta tos, presenta dificultad respiratoria cuando hace algunas actividades diarias, tipo cuando se está bañando, cuando se está peinando, cuando tiene una expectoración, es importante que estos son unos signos de alerta, donde usted debe ir al médico y tener un control para saber si está presentando una enfermedad pulmonar obstructiva crónica. El diagnóstico que hacemos de una enfermedad pulmonar obstructiva crónica es por varios métodos. Empezamos, por ejemplo, teniendo unos rayos X de tórax, donde ¿qué vemos? Ustedes ven en esta diapositiva unos pulmones un poco más negros, unos pulmones muy agrandados. Entonces vamos a ver que este volumen ha aumentado, donde tenemos que los espacios entre cada costilla van a estar aumentados, donde vemos que no hay marcas vasculares. ¿Por qué sucede todo esto? Porque la unidad funcional, que son los alvéolos, van a perder elasticidad. Entonces, al perder elasticidad, se va a aumentar este tamaño de los pulmones y lo vamos a ver de esta manera. Otra forma de diagnosticar que también nosotros hacemos es el TAC de tórax, la tomografía axial computarizada. Esta tomografía nos permite detectar los signos de inflamación que tenemos en el pulmón. Si ustedes ven aquí donde les estoy señalando, son todos estos signos donde puede haber inflamación y donde podemos estar sospechando que hay un EPOC en nuestro paciente. Otro análisis que hacemos para este diagnóstico es los gases arteriales. Este análisis de sangre arterial es para mirar cómo está la oxigenación en el cuerpo, qué tanto oxígeno está circulando en el cuerpo de estas personas. Entonces vamos a ver si está el oxígeno bien o está disminuido, si el CO2 está aumentado, y todo esto nos va a indicar que hay una enfermedad pulmonar obstructiva crónica. Otra de las causas que no es muy utilizada y que no, digamos, no está en el común cuando uno se hace un diagnóstico de EPOC es hacer pruebas de laboratorio. Pero es importante hacer pruebas de otras cosas. Por ejemplo, otras afecciones que pueden ser las afecciones genéticas, que también nos causan EPOC. Por ejemplo, cuando tenemos un paciente que tiene déficit de alfa-1 antitripsina. Esta es una causa genética, no es una causa adquirida por inhalación de polvos, por contaminación, sino que es genética. Entonces tenemos que diferenciar entre las dos clases de enfermedad pulmonar obstructiva crónica que tenemos, y una muy clara es cuando tenemos un paciente con déficit de alfa-1 antitripsina que su diagnóstico lo tenemos que hacer solamente en forma genética. Pero lo más sencillo y lo primero que se hace y lo que normalmente tienen todas las clínicas o a nivel de consultorio es hacer unas pruebas de función pulmonar. Cuando nosotros tenemos un espirómetro, es importante en estos pacientes hacer esta prueba, que es un análisis muy sencillo que utilizamos midiendo cuánto aire está tomando el paciente, con qué velocidad lo hace y cuánto aire está expirando y con qué velocidad lo hace, con qué rapidez está haciendo. Ahí es donde vamos a ver nosotros si este paciente nos confirma que tiene un EPOC o no. También se utiliza en estos pacientes con EPOC el peak flow o flujo pico, que es un medidor. Este es un dispositivo que es muy portátil, como ustedes lo ven ahí. Hay varias clases de flujo pico y que se utiliza para medir con qué velocidad o la capacidad que tienen para botar el aire. Entonces eso lo puede hacer el paciente en su casa cuando ya está controlando su enfermedad. Y vamos a ver que tenemos el primero que ustedes ven aquí, que les estoy señalando, es el manual, es el que puede tener su paciente en una forma que no es costosa. Vamos a ver los otros que son los electrónicos que vemos aquí, que esto lo único que utiliza es una batería, pero la técnica que hace el paciente para expirar es la misma que hace con el manual. Y los últimos que han salido, que son los flujopicos inteligentes, que estos ya se utilizan con los celulares, se baja una aplicación, pero la técnica que hace el paciente es exactamente la misma. Toma aire y sopla fuertemente para mirar cuál es ese pico, para saber cómo está su flujo. Vamos a hablar un poquito de Colombia. En Colombia sabemos que diagnosticamos alrededor de 70.000 personas al año con enfermedad pulmonar obstructiva crónica. Por ejemplo, en noviembre del 2019 se reportaron 6.000 fallecimientos con una prevalencia casi del 9% y todas estas fueron personas mayores de 40 años. También quería dejarles unas recomendaciones y es muy importante cuando ya tenemos nuestro paciente diagnosticado con un EPOC, es muy importante, como les decía al inicio, tratar de prevenir que esta enfermedad se agudice, que esta enfermedad avance. Entonces tenemos que tomar medidas para que esto no suceda. Y dentro de las medidas hay cosas muy sencillas que tenemos en las guías GOLD, por ejemplo, y es trate de respirar aire puro, aléjese de las contaminaciones, aléjese de los sitios donde esté emanando partículas nocivas para ese pulmón. Evite el fumar o el estar al lado de un fumador. Ser uno fumador de segunda mano, como nosotros decimos, también es muy grave. No solamente el que fuma, sino el que está al lado. Entonces, evite estar en esos sitios donde son cerrados y donde hay personas fumando. Adopte hábitos de vida saludable. ¿Qué quiere decir? Que tenemos que tener una dieta nutritiva, comer alimentos muy saludables, hacer un ejercicio diario. El hacer el ejercicio diario no quiere decir que usted tiene que ir todos los días a un gimnasio. Hacer un ejercicio es solamente salir al parque, dar una caminata, trotar, montar bicicleta, hacer cualquier deporte que a usted le guste y que tenga a mano para poderlo realizar. Y algo muy importante es hidratarse. La hidratación es algo supremamente importante para todo el organismo. La visita al médico debe ser al menos una vez al año para que nos esté controlando cómo va nuestra salud y si hay alguna enfermedad pulmonar, que lo detecte muy tempranamente, en forma precoz. Con eso no vamos a tener mayores complicaciones. Muchas gracias y eso es todo por hoy.
Okay, thank you very much, Doctora Claudia. If someone had problems with the subtitles, because I got information that some subtitles didn't work for some users. So if you had any problem with the subtitles and you want to have the presentation fixed or with the proper subtitling, you can email us. So the next speaker is Kristen Wheeler from the COPD Foundation from the USA. Christine is the VP and the Public and Professional Education Officer of the COPD Foundation, and she's going to talk to us about maintenance.
Hi, everyone. My name is Kristen Willard, and I am the Executive Vice President of Public and Professional Education at the COPD Foundation. I am just thrilled to be here today to talk with you about the management of COPD and our perspective here at the Foundation. So let's get started. So there are so many things that you can do while keeping in contact with your healthcare team to manage your COPD at home. These are just a few of the actions you can take. There are more of these, but I'm going to highlight a few of these today, and we can see what you think if these apply to you. So let's start with medication and device adherence. This is really, really important. So what we're talking about here is understanding how your medications work, right? What are they used for? Is this particular inhaler used for when I have symptoms of flare-ups or when I need a rescue inhaler? Or is this something I use for daily use? Understanding exactly what they do in your body can be helpful for you too. So these are questions that you can ask your doctor. When you understand what they do, it makes it more likely, I think, for you to use them on a regular basis to get the most out of them. Understand how you use them. That's also really important. Make sure that you're showing your physician or your pharmacist exactly what that looks like and step by step how you use, say, your inhaler. That way they can point out to you if there are modifications or changes that need to be made in the way that you're using your inhalers, again, so you can get the most out of it. I know this is not an easy one, but keep those medications refilled. Make sure that you put reminders on your calendar or sticky notes someplace, or even have it set up through your pharmacy to remind you to make sure that you have enough medication so you're never going without. And please, if you have oxygen that's been prescribed, use it exactly as prescribed. We know that sometimes it can be nerve-wracking for people to use their oxygen, especially in public, but remember, we all need oxygen. As I heard somebody say yesterday, we are all addicted to it. So be sure you're using it and using it just how it was prescribed for you. Another thing you can do is keep an eye on your normal symptoms. So COPD can be very different from person to person. What you want to do is keep an eye on your symptoms to know what might change. When there is a change from your normal, be sure you know what to do. So it's having a conversation with your healthcare team ahead of time. So if I have inhaler use that's increased, my rescue inhaler use has gone up, that could be a sign. It could be that your mucus has changed color. Keep these kinds of things in mind and be sure that you know what to do when you see those. Other important steps, and I know this goes without saying, but I will say it again and again, quitting smoking is the absolute best thing that you can do right off the bat to keep yourself healthy when you have COPD. So please try, and if you fail, try again. Staying clear of triggers in your environment, as you can see this next one down, and that's different person to person. Triggers could be wood burning stoves or burning things being burned in your environment. The smoke from that can be triggering for a lot of people. For some people, it could be weather. For some people, it's the cold weather, others, it's humidity. Whatever makes it harder for you to breathe easy, try to stay clear of those kinds of triggers in your environment. And I know that this one is hard too. Keeping your appointments, this is really important. Keep your appointments with your doctors, make them ahead of time so they're already on your calendar and they don't sneak up on you and then you have to get in later because you didn't put them on the calendar. When you have them set ahead of time, they're harder to miss. Okay, and now really important things: exercise, activity, and pulmonary rehabilitation if you have it available to you. So sometimes it seems counterintuitive to people with COPD, but it's really important to be active. Okay, activity and exercise will look really different from person to person, just like the COPD is different from person to person. For some people, it might be that they get 10,000 steps a day. You may have heard that number before. For others, it might be walking to the mailbox and back or up and down a flight of stairs. Whatever is the program that you have agreed upon with your healthcare team is what you want to keep to. Also ask your doctor about pulmonary rehabilitation. That's a program, a structured program that's exercise, it's health education, support. See if that might be something that's right for you. So let's go on to this next slide. Using coping strategies and reaching out for support can be really important as well. So these are just a couple of coping strategies here. Taking some time to relax, to meditate, to be in the moment, to be separate from everything that's happening around you can really help along with some of the other things we're talking about. Listening to music, calling friends, stretching just to feel some relief in your body, right? These are the kinds of basic coping strategies that you can brainstorm and find something that works for you. Relaxation and breathing techniques can also be an important part of maintaining, so to speak, your COPD and being well. So things like diaphragmatic breathing, where you're making sure you're breathing from your belly. Things like pursed lip breathing, where you're slowing down. You can see this woman here doing this, slowing down your breath, being more deliberate, can help you to breathe easier as you manage your COPD. And these can help you with moments of anxiety as well, or moments in which you're particularly short of breath. Let's move over to the right. Support is so important as you walk through this journey with COPD. Reach out to family and friends. They may not even know that you need them. Join a support group. In this age of COVID, many of these are remote. So you might do something like the Better Breathers Club if it's available in your area. They have these in the United States. You might join a Harmonicas for Health program, which is a group harmonica program that the foundation has, which helps you to have a sense of community and to also feel like you're less short of breath by playing the harmonica. There is so much about COPD on social media, whether it's GAAPP, the COPD Foundation, or maybe an association where you live, through Facebook, Instagram, even LinkedIn, where you can engage with healthcare professionals, and Twitter. There are so many avenues and accounts that you can follow to get more information, to talk to people who have experiences like you, because that's really important for all of us who have a chronic condition. And there are even online communities, so essentially forums, where you can connect with people who understand what you're going through. As you see at the bottom, the COPD Foundation has an English-speaking community called COPD 360 Social, and I've linked to all of these. And that has nearly 52,000 people from 151 nations. So see if that might be something, or again, another platform where you live that might be helpful to you in reaching out to get support and learn more about your condition. On these next slides, I'm just going to speak to you about some tools that can be helpful for you to manage your COPD. So the first of these is our COPD Pocket Consultant Guide app. So this is in English. It is free from the App Store and Google Play. So if you just put in COPD Foundation, that will come up for you. And this has a variety of tools to help you to self-manage. It has, as you can see on the right here, an action plan in it. And this is what you use as sort of a roadmap for managing your COPD. You can see it works with a stoplight model. You have green days, we all have green days, yellow days, and red days. When you first make an action plan, you do it with your physician or your healthcare team. So, okay, when a normal day for me is this, I do this. When it's a yellow day and I see my symptoms getting worse, you can check off or indicate on the right-hand side under Take Action what it is that your healthcare team wants you to do. Should I report the symptoms to my doctor right away, etc. And then on a red day, when you need help right away, you would be able to check off what you were feeling and exactly what your physician expects that you will do. This, again, can be a roadmap to help you. Now, the COPD PCG app you see on the left has an interactive version of this action plan. It has so many other components, so I hope that this is something you'll download and look around in. It is a place you can track your immunizations, medications you are taking. It is a place where you can access educational materials, some of which at the foundation are in Spanish. And there's a calendar where you can store information about your symptoms and your activities. So that's really important as you progress through your journey with COPD. So you can see how there might be trends or patterns in what you're feeling. This is a way to document them in a handy way. You can also download the action plan for free at the link at the bottom of the screen. A few more tools that are fantastic, and I won't get to all of them, but you have probably heard before this about the GAAPP empowerment materials, the web content too that GAAPP has been putting out, which is just fantastic regarding all the different elements of COPD, maintenance being the one that we're talking about now that I've highlighted here on the screen, but be sure to take a look at those. The COPD Foundation also has an educational video series in English that will help you to know how to use your inhaler or your nebulizer. I've linked to that here, but you can find it on the COPD Foundation website. You can see on the right here where it says inhaler education, a respiratory therapist actually takes you step by step and shows you exactly how to use each type of inhaler and each type of nebulizer. So that could be really helpful to you as a refresher. And then, of course, check out our downloads library where we also have free information like our COPD guides for better living that have specific information that might be of interest to you, like traveling with COPD or nutrition or adjusting to being home from the hospital. That might be helpful to you. And lastly, I'll highlight that we have a new podcast series that was done in concert with mission-based media on a variety of topics. But the first one that's up right now is about the basics of COPD. What is it? What more information can I get, right? Where do I start? That's in this podcast. It might be something that'd be helpful for you to show family members or friends who have questions. And lastly, I do want to point you to a handy reference that you can print at this URL that you can see here, Tips for Living Well with COPD, that sort of encapsulates all that we've talked about today. Health and safety, again, taking your medications as prescribed, avoiding people who are sick, washing hands, just good reminders for keeping yourself healthy as you progress through this journey. Tools and techniques, right? Let's talk about the action plan with your physician. Let's learn about pursed lip breathing if you don't know already. And then when you do, using it when you feel overwhelmed or short of breath. And then a section on resources. Again, this is something that would be free to you on our website. So we hope you take advantage of any materials that are out there from trusted organizations like GAAPP, like the COPD Foundation, or again, organizations where you live, because these can really be helpful reminders, refreshers, or entirely new learning experiences that will help you as you manage your COPD. And lastly, I just want to say thank you for having me. It's an honor to work with this organization. GAAPP has been a good partner to the COPD Foundation, and please contact me with any questions you might have at the information below. Thank you so much.
Thank you so much, Kristen. Kristen is also here with us today. And thank you for this great presentation about COPD maintenance. Our next speaker is Professor Lee Thi Tuyet Lan, and sorry in advance if I have pronounced your name wrongly. And Professor Lan works for the Ho Chi Minh City Asthma, Allergy and Clinical Immunology Society of Vietnam, and she will talk to us about managing a stable COPD.
First of all, I would like to thank GAAPP for giving me such an opportunity to present the management of stable COPD in Vietnam on behalf of the Ho Chi Minh City Society of Asthma, Allergy and Clinical Immunology. I am Dr. Lan. I am working in the UMC University Medical Center at Ho Chi Minh City, Vietnam. For the treatment of COPD, we adhere to the Global Initiative for Chronic Obstructive Lung Disease. We also have the Vietnamese guideline for chronic obstructive pulmonary disease, but mainly based on GAAPP. To take care of the COPD patient, we think that the most important thing is we have to take care of them as outpatient. It means that when they are in the stable status, to prevent the exacerbation, which is very serious and very expensive. So we build up the asthma COPD outpatient care unit. The acronym is APEPOC. One APEPOC must have one trained doctor for management of asthma and COPD, a trained technician, nurse to perform the spirometric test, have one spirometer. The most important thing is to have the medication in insurance list. And we also give the such a one unit, one software for the medical records. And it is the our university medical center at Ho Chi Minh City. Here it is, we have a build up the first APEPOC since the year of 2000. Now I would like to show you what we have done to build up one APEPOC for rural district hospital. The first thing is we have to go there to open one workshop on asthma and COPD management training for doctors, for technicians, and for nurses. And at the end of the workshop, we hope that they know how to manage asthma and COPD in stable status and also in emergency. And it is our task force where we prepare to go to the hospital district in southern part of Vietnam. When we come here, we meet the patients and we have the screening by the questionnaire for asthma and for COPD. And after that, the selected patients will have one chest X-ray. It's a very important thing because in Vietnam, the prevalence of tuberculosis is still very high. We have to exclude those patients before doing spirometric tests. And it is the spirometry. It's a very important, it is a crucial test to make sure that our patient have the obstructive pulmonary disease after the spirometric test with bronchodilator test. And we make the diagnosis of COPD based on GAAPP. It is we have a spirometrically confirmed diagnosis, which means that post-bronchodilator test FEV1 over FVC is less than 0.7, and assess the airflow of limitation based on FEV1 percentage of predicted. And we will assessment the symptoms and risk of exacerbation. We base on the symptoms based on MMRC and PET, and also the moderate or severe exacerbation history. So we will classify our patient into group A, B, C, D. The most severe one is a group D, and it is the most prevalent in our Vietnam. And we will have the clinical examination and prescription for the patient. The goals of treatment of stable COPD is to relieve symptoms, improve exercise tolerance, improve health status. It means that reduce symptoms and prevent disease progression. It is very important that the patient have to get the smoking cessation. It is very difficult to make them stop smoking. But the most important thing is to prevent and treat exacerbation. Prevent exacerbation is the most important thing in management of asthma and reduce mortality. So for the treatment of stable COPD, we have to reduce symptoms and reduce risk based on the goal 2021. The initial pharmacological treatment, we base on the group A or B or C or D. The group A is the bronchodilator. It is the short acting. It is feasible, accessible in Vietnam. But go to group B, where long-acting bronchodilator, because of the cost, it is not available in every hospital. LAMA, it is the same thing, long-acting bronchodilator, LAMA and LAMA ICS. So we have those medication in the big hospital, but in the rural district hospital, it is not always available. So it is a big struggle with the insurance company to make sure that the all APEPOC have those drugs in the insurance list. And we have to demonstrate the use of inhaler device because it is rather difficult for our patients. And we have also at the end of the visit, we organize one patient education to let them know what is the COPD, how important to get the stable status, to continue to go to the doctor, everything. The follow-up visit, the first following visit is after 1 month, and after that, every 3 months. We also encourage our patients to have a vaccination, influenza and pneumococcal. It's very important because it reduces the exacerbation. And the goal 2021 have suggested that patients have a TLAP vaccine to prevent the pertussis. It is already new. And for the follow-up, we will ask our patient whether they still have dyspnea or worse if they have exacerbation. So based on the medication that the patient are treating, we will decide what will be the next step. But the most important thing is to avoid exacerbation. There are so many options. We will have all of those medication, but again, only in tertiary hospital. For the district hospital, it is very difficult. Not saying about the common health post. So in 20 years, we are trying to build up a APEPOC network in Vietnam. And up to now, we have 235 APEPOC units in 53 over 63 provinces in Vietnam, 73 over 704 district hospital, and we do not have any APEPOC at the commune health post for primary care. We also joined with the GAAPP, Global Alliance Against Chronic Respiratory Disease, and we have an annual meeting where we can demonstrate our results and get advice from the experts in the GAAPP. So for the conclusion, we would like to underline that the management of stable COPD outpatient to avoid exacerbation is extremely important, the most important. And a network of asthma COPD outpatient care units, APEPOC, from tertiary hospital to primary care health post is developing in Vietnam. And now we are building up EcoQ in district hospital to increase the accessibility to COPD asthma care of patients, and will have the primary health post later on. And we are looking forward to an international cooperation in building up EcoQ in Vietnam. And we appreciate the cooperation of GAAPP very much. Thank you for listening.
So thank you very much, Professor Lan. That was a very interesting presentation on the Vietnam perspective on managing stable COPD. Our next speaker is Ms. Gundula Cobham-Miller. Gundula is a strategic marketing and health consultant and coach and presently she is the leader of the Lungenunion in Austria, and she's going to talk to us about the management of flares in COPD from the Austrian perspective.
Hello, everybody. My name is Gundula Cobham-Miller. I am health care consultant, and I'm working for the patient organization in Austria. I've also been working for an international organization, and I have experience in the pharmaceutical industry. So it is very important that the patient finally comes to the center of treatment. And I'm very happy to see the empowerment guide for patients with COPD at the GAAPP platform. I hope everybody will use it. I really hope that you're going to have it translated in your own mother tongue, because it's important that patients understand, that we patients understand the importance about patient empowerment. So this empowerment guide for patient is about the fact that COPD is still underdiagnosed, that the treatment impact for COPD is not sufficient. There is a lack of communication between patients and doctors. There is a lack of evidence for monitoring, and self-care is not promoted enough. So this is why this empowerment guide is here now, and we really hope, and I really hope, that you will use it and you will learn how to manage your COPD better. My topic in this guide is the management of flares, and I'm going directly to it now. So the objectives of the treatment of flares is to minimize flares if they occur. And if they occur, we also hope that they will occur the next time a lot later. So the most important thing actually is to prevent them. And if you cannot prevent them, then it's very important that the severity is low. So if it's possible not to be admitted to the hospital, that would be best. But it's always depending on your health status before the flare comes. It's also dependent on the health system that you have in your country and so on. So how can we manage COPD flare-ups? The best thing would be to prevent them, but we cannot prevent sneezing family members or friends. We cannot prevent rainy seasons, and when the season starts to become cold, we cannot prevent freezing. Also, sometimes, you know, when we go somewhere, maybe we don't have the scarf, or maybe we didn't pack the jacket. So you cannot prevent that. You cannot prevent a crowd of people. Even, you know, if you go to church, for example, if you are in public transportation, or if you just go to the supermarket, sometimes you might come up to a crowd, and sometimes there is a virus in between it, and maybe you catch it. So it's not easy to prevent flare-up. So what we know if a flare-up occurs is that the exacerbation will last some time, maybe very long, depending on your COPD status from the beginning. It can last between 2 and 8 weeks, maybe even longer. We know if we have a flare-up, the lung function will decrease, and some things might not be that easy to manage anymore. What's really bad is if you have a virus infection, that a bacterial infection sits on top of it. So it might be necessary that you need antibiotics additionally to your inhalation therapy. So daily life will be affected if you have a flare-up. So what can we do? The sooner the better. The sooner you realize this is a flare-up, you have to start to increase your inhalative medication. You have bronchodilator medication so that your lungs get better air. But you also have anti-inflammatory medication, which is the corticosteroid, which you might have to increase. So depending on the severity, the better you start with your inhalative medication, and the sooner you increase it, the better it is. You also have the anti-secretion inhalative medication, which helps, so that the breathing doesn't get so difficult. So make sure that you see your doctor early enough to ensure that you have antibiotic therapy at home, just in case it will be necessary to take it. And always stick to the doctor's advice how long you need to take the antibiotics therapy. Make sure that you have enough oxygen supply at home, because it's not the best idea to go out when you are in the midst of a flare-up. And then inform family members or friends how they can support you, just in case you need something additionally. The management plan for flare-ups is part of the therapy plan that you should have anyway. So it's always good if you have a medication plan. What is your current treatment plan, for example? We always should document which medication we take, how much we take of it, and when do we take it. So if you have a flare-up, it's good, if you know from your last flare-up how you did increase your medication. So that saves you a lot of time if you know, okay, in general, I take it 3 times a day, 1 puff. Maybe it's good to take 2 puffs 3 times a day, just to kind of keep the flare-up not so strong. So always important that you write down the change of medication that you take in a flare-up for the next flare-up. Also write down which antibiotic that you used and if it helped you and how long it took you, to see the benefit of it. Because that, the more we know about how does this work, the better it is. In case you have to go to the hospital, then please do it. Stay in the hospital until you get discharged again. If you get discharged, please make sure that you have an appointment for a follow-up visit. It's important that you go to the specialist after maybe 3 weeks, the longest, to see if your medication could be adjusted again. When you come out from the hospital, it might be increased. So make sure that you have a follow-up visit after your hospital admission, just to make sure everything is in the right place and that you have the right medication. This is one slide out of this empowerment plan. You see it's about inhaled bronchodilators, antibiotics, corticosteroids, also about oxygen therapy, physiotherapy. Don't smoke. This is try not to smoke, especially in a flare-up. It does not help at all. Make sure you have a follow-up visit And yes, the most important, when a flare-up comes in, try to reduce the symptoms as soon as possible, and to reduce the severity of the flare-up. It's very important. Another checklist, which is at the end of the patient empowerment plan, is the objectives that you should monitor. And if you stick to all these, to these 7 points, what you should monitor, which we already talked about, then you should be fine. So the next time you have a flare-up, just make sure that you are informed, and I wish you all the best to recover soon again. Bye.
Thank you very much, Gundula, for your presentation of management of flares from the Austrian perspective. Gundula is with us today. If you want to ask her anything after this last session, we will have our discussion. Our next guest is Joseph Idigba Awuru. He is the patient leader of Hope Life International from the Gambia. Joseph should cover the topic of COPD and associated diseases and COVID-19, but considering the pandemic situation, we have focused his presentation on COVID-19 and COPD from the Gambian perspective.
Thank you very much. My name is Joseph Idigba Awuru. I am the founder of Hope Life International Organizations in the Gambia. And I'm here to just give a little brief about COPD patients and COVID-19 in the Gambia. Unfortunately, this COVID had to come in and then compound the problem with patients with COPD. As you all know, COPD patients suffers from lung health issues and breathing problems. And so when the COVID-19 came in, many patients were diagnosed, and those who were diagnosed were people related with COPD. And so what we have normally advised them to do, and the suffering they are going through, is that even though we lost some of them, but some of them recover. And we discovered that we have like about 50% of 50% who are able to survive. Those who have suffered, those who are infected with COVID-19, patients with COPD that are infected with COVID-19, we have lost about 50% of them. 50% of them who have survived. So the condition they have problem with, the condition they have was the breathing problems, and these breathing problems have to do with what they used to do before, what had been compounding the problem, like smoking cigarettes and then air pollutions. And then we told them, look, you cannot continue to smoke, because when you go to a particular place, when you already been diagnosed to be having these problems, you cannot continue to smoke. So we advise them to keep away from smoking. And also, as COVID-19 regulations is that keep distance, and when you keep distance, and then you'll be avoiding coughing. And this coughing are one of the things also that also spread, because some of these diseases that problem that we have with the COVID-19, because when they cough, definitely somebody else will get it. So we introduce the use of masks, and then like some of organizations were able to get some masks from the Ministry of Health when we got some supply. So we give to some of our patients. So, and in order to reduce the infection or reduce the death rates among patients with COPD, we gave them that regulations, give them the strict instructions, and then we monitor them often. So when we monitor them, we'll be able to know, that's why we'll be able to know the record. We lost only 15%. I was like trying to explain earlier, only 15% of all the patients that have this COPD in the Gambia. one of the things that we do mostly, because most of these patients suffer because they have no finances to be able to take care of themselves. So we were able to support them somehow with finances because there was lockdown. So we support them somehow with finances, and we support also them with food, support also with them with any other support that we need to assist them with. We went to the government, and when we go to the government, we're able to explain to them some of our patients that have these issues, and then they were able to support, because we are fully registered with organization in the Gambia with the government, so we have Gambia support. So we also trying to also introduce some of the material that we need that need to help them to keep them alive, So we introduce like machines, those who are already suffering with this machine breathing that will help them to breathe very well in the Gambia. So we support them with that. Like 4 or 5 patients that are diagnosed, whenever they call us, we give them, we support them with that, and we rush them to the hospitals, and they are being assisted with some of this machine that help them to breathe effectively. Like I said before, and then they still keep up with those patients with asthma with the inhaler. So they still keep on with that. So the oxygen is very important, and we normally use to support most of these patients that have these difficulties in breathing during this COVID-19. Normally, generally, COVID-19 is coming, I mean, it is already reducing in the Gambia, but then the effect is still available, because many of them who are already jobless are still lost their job, and then they're still finding it difficult to cope in the society. And some of them, in fact, they've already got more additional diseases that those that completely with them. And so all we are trying to do is just to see how we can manage the situations with the COVID-19 now, this patient with COPD. Thank you very much.
Thank you very much, Joseph, for your presentation on the COVID and COPD situation in the Gambia. And thank you for your perspective and with your very unique challenges in your region. Before we start the discussion, I would like to thank the generous support from AstraZeneca that made possible all the 2 projects that we have presented here today, and that contributes to the sustainability of GAAPP and the organizations that we represent. So now I will open the forum for everyone to speak. I will let you unmute yourself. And I would like to start the discussion with one very interesting question that Pauline Master has presented in the chat. Pauline has a question regarding the end of life caring, if that should be included in any COPD guidelines. So I would like to have the perspective, especially I would like Nicole to give her perspective, since I normally live in the Asia region, and that COPD end of life care, that's something that is a very normal discussion that the patients and doctors have. So I would like to have the Western perspective on this. So okay, so I think everyone can unmute. Whoever who wants to speak is free to reply this question. Thank you.
Jetzt muss ich kurz da mir einschalten, gell? Jetzt hört man die dann, wenn du jetzt.
Nicole, are you there? Can you?
Here I am. Do you hear me?
Yes.
Yeah?
Yeah. So what do you think about Pauline's question on end of life caring or end of life?
Yeah, the question is very appropriate. Pauline, thank you very much for this. Very important, the last stage of COPD. What we did here in these COPD empowerment guides, we try to foster especially the self-control of the pathology and the co-responsibility of the of the patients in order to the COPD. So we didn't foster too much on the last stage, but you are absolutely right. And that should be done. That should be done, really. It's some great input and important input at the same time. On the other hand, what we tried, only let me say something, what we try to do with these empowerment guides, we try to involve also not only the patients, but also the relatives, also the families. I think this is very, very important because, you know, most of our COPD patients depend not only on themselves, but also, or especially on their families. And of course, the last stage is absolutely terrific. So great input, and we should work on this. So thank you very much for this input. Thank you, Pauline.
Thank you, Nicole.
And I think too, one of the things I'll just mention, this is Kristen, is that this is another thing I think our community is trying to normalize, right? The conversation around palliative care and not just end of life care, but supportive care because you have a chronic condition, right? So I agree with both of you. The more we talk about it, the more we normalize that conversation, just like we're normalizing shared decision making through these kinds of conversations, through the video that you've produced, etc. So I think that palliative care conversation is really, really important. And I love to see people talking about it, especially physicians. The more we can get docs talking about it, the better.
Absolutely.
I think it's like other conditions, isn't it? They always come up before COPD. So, you know, cancer and heart disease, and then COPD. And it's the same, I think, in palliative care, is that it's always the cancers and it's always people with heart disease. And whilst I really feel for them, you know, I think COPD needs to be up there with those as well, right through to the end. But I really appreciate the guides. They look fantastic, and I'm certainly going to have a good look at them.
Pauline, I would like to ask, to put a question to the whole here. So considering we have seen these patient empowerment guides that has been adapted in being patient, recomposed as a patient-friendly language for all the patients around the world, and they're based on the GOLD guidelines. So so we see the GOLD guidelines, they have some measures and standards that may be accomplishable for many Western countries. But I would like to have, I don't know if Gundula is here, since he has so much, since you have so much experience in developing countries, do you think the GOLD guidelines or these guidelines are realistic for every kind of country?
I only can talk about developed countries, and is this what you meant?
So do you think that the guidelines are realistic for every country, including the developing countries, like we have seen the African perspective and etc.?
Yeah. Okay, I got it. I think they're helpful because I think the issue was to really take the GOLD guidelines, which are also relevant for these countries, and show them a standard. I mean, maybe they are not there yet, but it's about patients' rights actually to have these standards also in countries where they are not yet there. I think it's always important to have that possibility to compare oneself to another country, you know, so that we have arguments in our country where maybe the standards are not yet fulfilled, to talk to policy health people to change their own standards to improve, actually. So I think that, yes, they are helpful, and hopefully they will be able to use them if they can, just for the discussion that, you know, they also should have the same healthcare standards or the same options like in countries where they do have more possibilities already. But it always should be kind of, the goal to get there, so that this is also possible for people in these countries, in low-income countries. Yes.
Sorry, I would like to say something about this.
Yeah, go ahead.
I agree with Gundula. I think we should be ambitious. We should have our bench at the same time as well. We should develop our countries and help from other countries. So a lot of things done already in Canada and the United States, and very important for us at the same time. So although we are, like Spain, we are a developed country, I consider Spain a developed country, but maybe the COPD Foundation is much more developed than us because they work since a lot of time. They have much more members than us and a lot more resources at the same time. So it's important to learn from each other. So what I said at the beginning, to work together and to help other countries at the same time as well. So I like the perspective of Gambia as well. So interesting, very interesting. Of Vietnam at the same time. We had different perspectives of different countries coming from other regions. And I think that's very important to help us and to develop together, because the COPD is the third stage of mobility at this time in the world. So should be important to work together really, and to do things in order to decrease the visibility, to decrease the underdiagnosis, to decrease the mobility of COPD. So in that case, I think although other countries could be more developed or less developed, but we can learn from each other. So this could be very interesting. And these empowerment guides, and Gundula is very important part of these empowerment guides, I think could help other countries in order to have at least a guide how to work, how to empower their patients and the surrounding, and even the physicians at the same time. So for me, that's very important. And that's only the beginning, what I said before. It's only the beginning. We will continue with this. We are trying to, and the next one, I don't know if I can tell you this. Victor, I don't know if you agree, I can tell you this or not.
Yes, please be free to tell your mind.
So we of course we want to continue with this, and this what I said, it's only the first phase, and the next phase is what we want to foster is to turning scientific communication into social communication. So what we will do, the next thing we will do is to identify scientific studies of the disposal of the COPD patients. So we want to identify the most relevant and important scientific studies, at least 15 scientific studies, which could empower our patient and the environment of our patient in order to make their own decision, or together with the professional,
Thank you, Nicole. That project will be announced shortly. But Nicole has given us a preview of this project. Will be announced on World COPD Day, which is a continuation of these empowerment campaigns in a global scale. So, and again, thanks APEPOC for all the effort and the cooperation with GAAPP, and I'm sure with so many other global organizations. Gundula.
Yeah, I just also want to say thank you to GAAPP, because it's so important to have these global standards or these statements. And we're talking about shared decision making, but if we don't give the patient the the necessary tool with it so that he can understand, or she can understand the guidelines, because they are not easy to understand if you look at GOLD. So the empowerment plan now helps a lot, so that the patient can read it and he knows what kind of questions do I have to ask the physician, for example, because he can read it in his in a patient adequate language, and then he can he's educated, if he's interested, he's educated enough to know the differences between treatments, for example. So I'm very thankful about that, because we are also working on implementing the shared decision-making process in Austria, and we have a tool. We have the German patient guidelines, so that we can hand them over to the patient and say, okay, here is something for you to read. And the next time when you go to the doctor, you know the process of shared decision-making. Go ahead and pose your questions, and then you will get the information that you need. And we all know it will give you a lot more quality of health and a better outcome and a longer life, hopefully.
And I would like to take the advantage to encourage other countries in order to demand more translation as well. I see Karen. I don't know, Karen, where you come from. So maybe you need maybe Dutch. I don't know.
No, I'm actually in the U.S.
Oh.
I'm an advocate for the COPD Foundation,
Okay.
but the background is German.
So. I thought it was Dutch. Sorry about that.
Oh, it's okay. It's okay.
But we have to say that Karen also has some Norwegian in her.
Well, yeah, I do.
Because I happen to be, anyway, I'm a patient also, and Karen and I are friends, and we both do a lot with the foundation. And but
yeah, so your comments, thank you very much, John. Very useful and very interesting. But I saw the name Karen Reitemeyer. I thought she must be Dutch. So
well, I would love to move. Yeah. I think this has been a wonderful presentation. I wish more patients had listened. I know there was another one here who has left. She may have had another appointment, but thank you. Thank you very much, all of you, for what you're doing.
Yeah.
Thank you for your attendance.
Thank you, Karen.
It needs to be global. It really does. We all need to come together, and it's meetings like this that bring us together, and we share and we learn from each other, patients and physicians and researchers and foundations. It is a global effort. Yeah. It needs to be. And we think, as patients, we thank you for that.
Yeah.
Thanks, Lina. So I think we have reached our, oh, sorry, Nicole, were you saying something?
No, I'm happy that Ruth is here as well. I don't know if she heard something about the next stage or the next phase of the project, which will include scientific studies. So it would be great if she would be part of the board of this next part. You know, we want to identify the most relevant scientific studies related with quality of life for our patients, to make the abstract and the conclusion patient friendly, and at the same time to have a resume or a recommendation for our patient at the same time, you know, to really to prepare the scientific studies in order to be at the disposal of the whole society, not only patients, you know, for the whole society. You have to consider it that our underdiagnosis is quite high, very high at this moment. So we have to, our target doesn't have to be only our patient, but also the whole society. That's what we try to do next. And as Ruth, the president of the COPD Foundation, is scientific, that I'm very happy that she is here now.
No, I listened to the whole event. It was really excellent and really great points, and I'm absolutely happy to participate and contribute.
Good.
Very much aligned.
Happy. Sorry, I'm here with my allergy. I'm not crying or whatever.
She's just so happy that Ruth is participating. You brought her to tears.
Okay, so we have to stop here. We have reached our time, and I know everyone has other meetings to attend, so I don't want to steal more of your time. So I would like to thank you, everyone who has been live on Zoom, everyone who is live on Facebook, which I don't know how many, but quite a few. All your questions in Facebook will be answered afterwards by us. And again, thank you, everyone. Thank you all the 6 speakers from the 6 countries who collaborated for this webinar that will be also live, we recorded on YouTube. And I wish you all a happy weekend and a happy World COPD Day in 3 days, right? In a few days.
Hope to see you once in person. Pauline, you're from AstraZeneca. Maybe you can arrange something.
I can